AM 1220 KHTS, HometownStation.com. Here we are again on a Wednesday morning with the Providence Holy Cross Hour. I am T. I'm normally with you Monday through Friday, your afternoon T, doing your drive time. But I'm here today with Dr. DeMassa, who's the Associate Medical Director. He's one of the ER physicians over at Providence Holy Cross, and we're going to take an opportunity to chat a little bit about that today. Dr. DeMassa, thank you for being here.
Thanks for having me, T.
All right, get right up on that microphone. I would love to, the ER. Now, for those of us of a certain age who grew up watching television programs, you know, growing up, there were all the medical shows that gave this image. In fact, there's a couple new ones on, I think Showtime has out, where they give us this glimpse into the world of the ER, and it's always this nonstop, crazy activity, always high drama. How many years have you been working in the ER?
So I finished medical school in 2001, and I finished my residency in 2004, and I trained in emergency medicine. So I basically have been in an emergency room since 2001.
So how does it compare to what we see on television? Is it always high drama?
I get that question a lot. So the way I answer it is, we do see similar cases that you see on all the TV shows. They're just not as rapid back to back. You know,
right?
In the midst of the trauma and stake through the leg, we'll also see a rolled ankle, and we'll also see a cold every once in a while. So
but it makes for good television drama.
It sure does.
Not good patient care.
They cut it a lot quicker on the shows. But we do see those exciting cases, and that's what I love.
So in the ER, and when you, throughout a typical day, what is your shift like?
Absolutely, yeah. So we work at Providence Holy Cross, and in most places about 9 or 10 hours at a time. So we have shift work. We come in, we know when we're going to start. We typically know when we're going to end, although it takes a while to wrap up. The thing about ER, though, is that we have to be there when the patients come in. And most ER patients come in the afternoon and evening. So a lot of my shifts are at night.
That's the heavier traffic?
That is the heavier traffic, yeah. So that's when I come in, and that's when we see the patients. I typically see about 25 to 30 patients a shift. Mm-hmm. So it's a pretty quick clip. It's a little over 3 patients an hour. And I'll see everything from the serious traumas to someone who's what we call having a code or their heart stopped, to the simpler cases like a cough or cold.
Now, because you're there for a pretty long stretch of time, you probably get to see the patient, I would imagine, from beginning until the end of their visit, because the turnaround, if they're going to be taken into the hospital and become an inpatient due to whatever has brought them to the hospital, or you send them out home, you're there for the duration of the patient's care, right?
That's right, and that's what we really aim to do. We like to see them from the time they come in as quickly as possible to the time that they're what we call disposed or discharged. And that will either be to, inpatient or to be discharged home. And typically I will stay until all of my patients have that final discharge.
Now, do you find when, I know that we're going to talk a little bit about the ER. We're also going to talk about the trauma center and what that means. But do you find that because it's the ER, is emotion pretty high with your patients when they come in, because they're coming in usually for the most part, a desperate situation. They're coming to you because they have to be seen. Every now and then, I'm sure you get someone, the doc's off hours, and it might be a routine garden variety issue. But do you feel that you're more than doctor, you're part therapist also?
Absolutely. That is a huge component of what we do, is just managing anxiety, managing families, and just helping them through their stay. Everyone comes to the emergency department with both an expectation and a certain amount of anxiety about what's going to happen, and we try and address both of those. So, and certainly, we have a lot of support services beyond myself if we need to go to the next level to help people.
All right, and we're going to get ready for a break in a moment, but I'm super curious, when you first came into the ER, having had your education, reading the books, doing what you needed to do, some hands-on at this point, was this where you thought you would end up? Is this where you thought you wanted to be?
Yeah, so I went into med school watching all those shows that you talked about earlier, so I did have a little bit of blinders on, and I went to med school thinking I wanted to do emergency
don't want to do
medicine.
ER. Yeah.
So, and they do a good job in med school introducing you slowly to it, so you're not overwhelmed. You do rotation, maybe a small rotation in the ER, then you take 6 weeks, and then you have your internship and residency. So it's a gradual increase in terms of what your exposure to the serious cases. And I've loved it. Every second of it I've loved.
I love that.
I'm truly blessed to be an emergency room doctor. And I'm just so thrilled with my career. The only thing I'll tell you is that when you're 22 and picking a career, you have this vision that you're going to go surfing in Bali on the weekends with your time off, and then you get married and have kids, and your kids
your
are
career's a little different.
Dad, why aren't you going to my baseball game tonight?
Oh, because I really want to take you to Bali to go surfing.
I know, right? The flip side is, as an ER doctor, I do have a lot of free time, which is nice to do things like the radio show. It's just that it ends up that a lot of my shifts are at night, which is sometimes a little bit tough. But
that has to be tough.
Yeah.
Because you're that graveyard dad who comes home and the kids are getting ready for school and you're needing some shut-eye.
Yeah,
that has to be. We're going to talk a little bit about the stress of what you do, not only in the workplace, but also how that affects you when you're out of the workplace. Because I know, we all have stress in our job. Don't let anybody kid you that they don't. There's a level of stress of some sort. But I look at you guys and I think, wow, you deal with our stresses when we walk through the door of the ER. I'm very curious about the stresses on you when you walk out that door and how you deal with that. We're talking with Dr. DeMassa. Again, he's an ER doctor over at Providence Holy Cross. We're going to speak to him a little bit more as the hour goes on. Stay with me. We're going to take a break. As have been heard before, it's to keep the lights on and the microphones humming here on your hometown station, AM 1220 KHTS. AM 1220 KHTS, your hometown station. I'm here today with the Providence Holy Cross Hour, speaking to Dr. Giancarlo DeMassa, who is from Providence Holy Cross. He's the Associate Medical Director there in the ER. He's an ER physician. And we were talking a little bit about how coming into the ER is very stressful for a patient. And as doctors, your job is to not just deal with the physical, but you find yourself dealing with the psychological also. And in this stress, I know that you have a very high stress position, regardless of what's going on in the day, because you're constantly, on call. What do you do at the end of your day to kind of deal with that stress? Because it must also be stressful when you go home and your clock is off.
Yeah, it is. So just to back up a little bit, though, it certainly is a stressful job, and it's a high-intensity job. But I'm lucky in that I feel like I've been given all of the tools to deal with that stress. So there's this idea of positive and negative stress, right? So when things are crazy and exciting and someone's crashing and I have to intervene, it's stressful in the way that my heart, skips and I'm at the ready, but I also have the tools to deal with it. And it's very different from a lot of the stress I see in my patients, which is sometimes I don't have enough money to pay the rent, my boyfriend broke up with me, nobody's taking care of me, and those are stresses that my patients don't necessarily have the tools to respond with.
Right.
So they're very different kinds of stresses. And in some ways I feel blessed to have my stress, and I feel like it can be a positive thing. But certainly there are horrible cases that we deal with.
Well, and the stress that you're talking about, where your heart is skipping and you're absolutely in the moment, high intensity, it's a positive stress because you're doing something to help someone.
Exactly.
So it's not a negative stress.
Right.
But then the idea that, that's on you all the time. You're wearing that. What do? You have the tools, you say, did you grow up in a stressful environment?
I didn't grow up, the son of physicians are in a stressful environment. But like I said, it's a slow build up to that point where you're ready to take on a whole ER. It's over 7 to 10 years with your residency training. So you kind of build up to do that. And all that being said, I certainly do take stress home at times, especially when there's a death. I really have trouble with with bad outcomes for pediatric patients. That's really hard for me. I'm the father of two young boys. So I do take it home, and I'm very lucky to be married to a psychiatrist.
Oh, this is working out. See where you get your tools.
I can get a little extra couch session if I need to. And truth be told, it's a communal environment in the emergency department. It's not just me. And it's not just a doctor and nurses. It is a group of doctors. It's a group of nurses. It's a group of amazing techs.
It's a tribe.
Yeah, it's a tribe, and it it really is all of us taking care of the patient. So if there's something bad that happened, first of all, I can go ask for help at any time from another physician or nurse. And also I can vent if I need to.
Yeah.
And boy, that's a lot better for me personally than having kind of a solo practice. And I think that's one of the things that I like about it is that I can immediately vent if I need to.
Right, and it's that group thing. What are some of the things, if you could be at liberty to tell me that you deal with the patient's stress? What kind of things do you bring to the table to help them relieve some of that stress? Because anyone who comes into the ER, they don't really want to be there. I believe
Absolutely.
they walk through that door going, where's the last place I want to be on a Saturday night is here in the ER. So you're the minute those people walk in the door, there's stress. What do you do to help your patient's stress level?
There are some very simple things that we do there. There's actually data that there are things, just small physical things that we can do to help patients, and we're really trying. We need to sit down when we talk to them. We need to let them get their first answer or their first description of why they're there out without interrupting them. We need to touch them. And all of those things actually help them quite a bit to relieve stress immediately. If it continues, obviously longer conversations with them. If it's a psychiatric issue, they're having severe anxiety, there are medications we can use. We also have support services for people that are stressed for reasons that I can't necessarily address, things that like homelessness, lack of food, and we have a social worker on staff who's there specifically to help with those things. So we kind of have a variety of ways, from the simple, like the sitting down, to more involved when we even have to admit patients sometimes to help them.
Right. Providence Holy Cross is, in addition to the ER, I'd love to talk a little bit about the idea that you are one of the few trauma centers caring for patients, not only in the San Fernando and Santa Clarita valleys. You are assisting people that come in, and I would love to know what is the difference between an ER and a trauma center. And can I ask, do you know how long that this has been in effect at the hospital there? And
that we've been a trauma center? Oh my gosh, longer than I've been there. More than 15 years for sure we've been a trauma center.
And
I don't know when exactly the date it started.
What is the thumbnail sketch of the difference between trauma and ER?
Sure. So a trauma center actually has quite a lot of kind of physician capacity behind it. So there needs to be a trauma physician, a surgeon, ready to go to the OR 24 hours a day on site. There also needs to be an anesthesiologist and an operating room free for any trauma patient that comes in.
Has to be free.
Free, open, ready to go if we need to rush someone to the OR, along with an anesthesiologist to staff that.
All right, and so trauma is that issue that comes through the doors that can't be met with just the simple ER. If you go to any other hospital that has an ER, they might not be equipped to take care of something that is relatively catastrophic at this point, and that's what that's what differentiates ER from trauma center.
Correct.
So it's the physician, it's the anesthesiologist, it's the equipment, it's the operating room, and it's a totally different bit of staffing.
Right. So it's specialty services as well that I didn't even mention, like neurosurgery and orthopedics, that don't necessarily have to be in the hospital, but have to be ready 24 hours a day.
They can be on call and nearby.
And have to be able to come in within 20 to 30 minutes.
We're going to talk a bit more about that. We're sitting here with Dr. DiMassa, who is from Providence Holy Cross, here on the Providence Holy Cross Hour on your hometown station, AM 1220, KHTS.